Kansas Director of Health said that he believes the state may be at the peak for new coronavirus cases. There were 186 new ones reported today, bringing the total to just over 2,200. In Missouri, there are now more than 6,100 confirmed cases. Part of checking into the hospital to have a baby won't just involve timing your contractions anymore, but testing for COVID-19. KCTV5's Amy Anderson talked with doctors about why that test is so critical.
KU and St. Luke's are two of the hospitals in our area that are now testing expectant mothers as they arrive at the hospital to give birth to their babies. A recent study published by the New England Journal of Medicine found nearly 90% of expectant moms who tested positive for COVID-19 were asymptomatic and could spread the virus in a labor and delivery unit without ever knowing it.
She was born this morning at 4:30.
It doesn't get much better than this. First-time new parents Jennifer and Mark Pazaranda say it's still surreal their baby girl is finally here.
Her name is Mila Rose Pazaranda. She's 7 pounds, 14.6 ounces.
Jennifer hasn't seen anyone outside of her husband and doctors for about 6 weeks. The pandemic putting a screeching halt to all those last-minute visits with family and trips to the store for baby gear. And things were dramatically different when they got to the hospital, too. The couple was stopped in the lobby for a temperature check before heading up to labor and delivery.
She let us know I was going to be tested. That was one of the first things they were going to do. And in addition to wearing the mask when everybody came in the room.
Jennifer's test came back negative, offering them a dose of relief that's tough to put into words. Dr. Kristen Wooten is an OBGYN at St. Luke's and says the health system started testing expectant moms for COVID-19 late last week. So far, all the tests have come back negative, but there is a protocol in place in the event of a positive test.
They do recommend in a COVID positive patient that baby is separated while, we kind of see what mom's going to do, and we can, do some counseling on how to care for the newborn with your positive state.
Dr. Wooten says the immune system of an expectant mother is different than everyone else's, so there's always the chance an asymptomatic pregnant woman could develop the sometimes serious COVID-19 symptoms right after her baby is born. It is for that reason that positive asymptomatic mothers are very closely monitored. Tonight, this new family says they are just grateful little Mila's birth was a safe one. What we know about pregnancy and COVID-19 is changing constantly. St. Luke's is hosting a Facebook Live session for any expectant mother who has questions. That's at 11 o'clock tomorrow. In Overland Park, Kansas, Amy Anderson, KCTV5 News.